Broadcast of this program is made possible in part by the South Carolina Farm Bureau, online at scfb.org, and by the Columbia Metropolitan Airport, online at columbiaairport.com, and by Time Warner Cable, online at timewarnercable.com.
And welcome back to This Week at the State House. And as we continue to look at this session, where we're headed, the House has finished the budget, sent their version of it over to the Senate. What will the Senate do with it? That's something we're going to look at today, because one of the big issues that's, might call it percolating in there, Medicaid expansion, the Affordable Care Act. Should we expand? Shouldn't we? What are the ramifications of it? How does it affect you? There are two sides, as we always indicate in these issues, and what we try to look at from a legislative perspective. Why do these things become controversial? So it's going to be interesting. The Senate, of course, has just finished the Superintendent of Education amendment. It did not get the required 2/3. It's not to say they will not go back to that. Early voting, and I think a nullification type bill is up on the calendar in the Senate. You saw on the show a very lively debate from the House of Representatives. We had two House members in here giving different perspectives on the Medicaid issue. And before we go to it, we want to take care of a few housekeeping things. And of course, I always want to welcome our friends at 518 of the Block Building who so closely watch this program. We always appreciate their attention to what we have to allow in the issues. But I also want to thank South Carolina Educational Television for the production of this program. And I also want to thank the South Carolina Press Association for assisting in it also. But we want to thank our sponsors who make this broadcast possible, and Time Warner Cable, the Columbia Metropolitan Airport, and the Farm Bureau for their sponsorship. Thanks again. With that, we hope you find this program very, not only educational, probably going to be entertaining. And with that, let me introduce the folks that we have here with us. Senator Brad Hutto, he comes to us from Orangeburg. Senator Hutto's been on this show before, very active on the Senate floor. Right next to him, very experienced legislator from the great county of Spartanburg. I think all of your district is in Spartanburg, isn't it, or is it?
Spartanburg, Greenville, and Union.
Spartanburg, Greenville, and Union. And of course, Senator Shane Martin comes to us. He also has been involved in a subcommittee looking at the subject of Medicaid expansion. What is Medicaid expansion? How will it affect you? Will it touch your pocketbooks? Will it affect businesses? Will it affect the standard of living in South Carolina? We're going to try to delve into all of that here today. I'll start with y'all, and let me just say, I'll start with you, Senator Hutto. Medicaid expansion. What is it, and are you in favor of it?
I am in favor of it. What it is part of what some people call Obamacare, which would basically have South Carolina take our uninsured population and put them on the Medicaid rolls, with the federal government funding fully that cost for the first 3 years, and then scale down to where in the end we would be responsible, I think, for 10%, and the feds would still pick up 90%. Now, when I say the federal government being responsible for it, it's really South Carolina tax dollars that we have paid to the federal government, sitting in Washington, waiting for us to bring back to this state, or not. So that's really the question. Over the next, until 2020, it's about $11 billion, average about $1.6 billion a year. So I would just suggest to you, if I had $1.6 billion right here and I said, you know, you can have that and you can use that to the benefit of the uninsured people in South Carolina tomorrow, go ahead and take it, and you wouldn't pick it up, I would think, I don't understand that. I do not understand that. So I think it is truly, for the first 3 years, no strings attached. We could take our uninsured population and move them to having insurance. And why is that important? Because people you don't choose to get sick depending on whether or not they have insurance. They get sick or injured. It just happens. It's a part of life. If they're uninsured, it's not like they don't get treated, but where they do get treated is in the emergency room, and that's the most costly place to treat somebody.
It is.
If they could have insurance, they would be able to get a doctor, to have a medical home, so that when they got the flu, instead of ending up in the emergency room, they would end up in their doctor's office. And that's what we're trying to do, is make sure that everybody has insurance, because it's a shame to live in the wealthiest country in the world and know that some people can go broke because they got sick. That is a terrible thing to think about. That almost anybody, because no matter what coverage you've got, there's probably some limit on it, you can go broke by just getting sick, and that's not right.
I've seen that with seniors where they get sick, they go broke, and become a ward of the Medicaid system. Now, Senator Martin, let me ask you, do you agree with your fellow senator as to what this is, and are you in favor of it?
Well, I think he explained partially what I believe it is, but I do not agree with him on that issue.
Tell me why you don't agree with him on that issue.
I've been fortunate enough to be the chair of the subcommittee that Senator Peeler put me on with medical affairs, and we've been looking at all of the aspects in South Carolina's options as it relates to the Affordable Health Care Act, or as some dub Obamacare, even the press calls it Obamacare now, and to look at whether or not expansion is a valid option. And I know you thanked ETV. I'd like to thank ETV as well. They were at all of our subcommittee hearings. They taped every bit of testimony on both sides, and people can go and watch and see all that testimony. And I think we had pretty good hearings there, Senator. Senator Hutto was on the subcommittee. He attended every meeting, and I appreciate that. The thing that I have, and it's been the thing I focused on, is our current state budget, because that's what we vote on, is our state budget. And I've been concerned that education is 54% of our state budget. Medicaid used to be 14% back in 2001, and it's grown to 30%. So it's on a slope like this now. So my concerns are, what are we doing to fix the slope? Because 54 plus 30 is 84, only leaving 16% for roads and bridges and police and forestry and any other services that we have. I'm trying to figure out how we reduce those costs, and that's one of the things we focused and asked Director Keck to bring us some legislative solutions. My problem is we're already unsustainable right now with our Medicaid growth. If we expand, it's just going to make it worse. Director Keck has given us a range because we don't know how many people may be picked up by the expansion. There's people now that are currently technically eligible, and if they're picked up under expansion, they're not free. They're not on the 100%. We have to pay them at our current Medicaid rates now on that 30% slope. We'd have to pay for those people right off the bat. So that's why I feel like we're on an unsustainable path. Why expand that unsustainable path with, we talk about our federal tax dollars being in Washington. The only thing I see in Washington is $16 trillion in debt. So I don't know how they're going to sustain sending that money back to us over that, quote, free period of 3 years. So that's where my concerns are in understanding. If they say it's free, we know that the 100% of the new people that go on, newly eligible people, not current residents who may choose to go on under expansion, those people would be at the 100% if the federal government has the money to even fulfill their promises.
Well, let me ask both of you, because the public out there is here, and this is part of Obamacare, and the legislature can refuse it. But isn't it accurate to say that Obamacare, the Affordable Care Act, what's going to happen in the marketplace with anybody buying insurance and everything, all of that is the law regardless of whether we take this or not?
Well,
Would you both agree on that?
It is the law, and one thing Director Keck is doing, whatever's law that wasn't struck down, portions of it were struck down, the mandates of the Medicaid expansion were struck down by the courts. Everything else, Director Keck has told us to tell our constituents that he is following the law.
Well, the reason I'm asking this is to kind of get the discussion away from, look, there are a lot of folks who don't like Obamacare, there are folks that do like it, but the courts have ruled it's constitutional, it's the law of the land. All right, so we have that. Right. Now we have the debatable issue that the courts are giving you. Do you want to take Medicaid expansion or don't you want to take it? And for the viewers out there to understand, ultimately, that's what y'all going to be voting on. You're not going to be voting on Obamacare. You're going to be voting on Medicaid expansion.
Right, and Director Keck has already advocated, and as well as the governor advocated, that we try and get those who are currently eligible for Medicaid on the rolls. So the folks that he's talking about, that maybe 200,000 that are currently eligible and we would be responsible for 30% match, right. They're actively advocating that we get those people on the rolls. It doesn't make sense that they won't go on and advocate that we get the other 400,000 people on the rolls for free. They're willing to put the first 200 on at a cost to the state. They're not willing to put the second 400 on at no cost to the state. And you know, you bring up, and we've all brought up the term Obamacare. People are polarized by that term based on how they basically feel about our current president. But when you ask them, do you think that insurance companies should be able to prevent you from getting coverage because you've got a pre-existing condition? Overwhelmingly, they said no. You ask them, should a family be able to keep their college-age student on their health care until they're 26? They say yes. If you break down what is in Obamacare and ask that to people, overwhelmingly, they like what's in it. They just don't necessarily like the name. That's not true. I personally think the name fits well. But you're right. We got to get beyond that and look at what the policy is. And the policy is this: if we don't take this money until next year or the year after, we can't go back and get the money we turned down this year. It'll just be money we didn't take. As we add these new people to the rolls, we're going to need new health care professionals to take care of them. And we have a study out there that says over the next 10 years or so, we'll add 44,000 jobs here in South Carolina, good paying jobs that'll be spread all around the state. You know, we get real excited, and rightfully so, when we get Boeing or BMW to come and put 1,000 or 2,000 jobs in one location. We're talking about 44,000 jobs statewide that would generate over $3 billion in income, either in taxes that they will pay, or of course the people that new people that are employed will buy groceries and spend their money and buy cars. It'll just put $3 billion into the economy. If we said tomorrow we could land a company that would come to South Carolina and provide 44,000 jobs, we'd be chomping at the bit to give away how many hundreds of millions of dollars to get them to come. We can get this for free. But my friend here doesn't want to take it.
What do you think? You agree with what he's saying?
Well, I understand what he's saying, but I don't think all the numbers add up. Everything that Director Keck has told us, that the hospital has come to, the hospital associations of people, have come to him to try to get their model correct that they were using. I don't think they have the numbers modeled correctly. I'm just going to go back to the point of our state budget that we have to vote on. Medicaid is doing this. If we expand it, we're going to get cost on top of that. And I just don't think we can afford it.
But you know what he's saying? He's saying that if I was going to give him $100 right now, and he counted it and it was only 99 in there, he wouldn't take it. That's what you're saying, that the numbers don't add up. So if it's not 1.6 billion, it's only 800 million, you still don't want it. Even if it was $1, you don't want it. Because what you're saying, well, they don't add up, so I don't want it.
Well, the problem is, if you're giving me something
I am.
for free for 3 years, at some point I'm going to have to pay you. And if I know in my reason, let's say a guy comes by.
You don't, though.
Let me give you an example.
You don't have to pay it back.
Let me say a guy comes by and offers to cut my grass for free for 3 years.
Yep.
All right? After 3 years, the advocates of this say, I could just tell him to quit cutting my grass. Well, what happens with the federal government is they'll end up coming back and raising requirements. So once they get you hooked for those 3 years, you can't go back. I think it's foolish to think that anything in the General Assembly, if we had a group of people that were insured with the Medicaid population, and 3 years later we said, oh, the federal government's turning off the spigot, even if they did keep their promises, this General Assembly is not going back to revert it, even if they came up and told us it's going to cost us 40%. We're going to have to figure out a way to keep that. And that's what I worry about, that we're not going to be able to sustain it.
So what you're telling me is that Republican-controlled General Assembly just can't exercise their will. They would know what to do, and they just couldn't do it.
I wish we had a Republican-controlled General Assembly. We do not have a Republican-controlled General Assembly. What we have is a solid Democrat majority when they have a few of the liberal Republicans join with them. And that's what we have in the state Senate. I don't want the people out here to be confused into thinking that we are Republican controlled, because we are not.
And that was an advertisement from the Tea Party. Thank you very much.
All right, let me ask the two of y'all. One of the issues that's come up is, if the law was set to get rid of the uninsured, the Medicaid was going to close the gap, and they're creating exchanges to allow lower income people to buy subsidized medical insurance. The complaint, as I hear it in the medical community, particularly from the hospitals, is that if we don't take the Medicaid expansion and we don't reduce it, those folks are going still to the emergency rooms and still to the hospitals, but the federal government is reducing the money that they were paying the hospitals for handling the uninsured. Who's going to pick up that tab?
Taxpayers. And let's talk about who those 600,000 people are that don't have coverage in South Carolina. They're people that go to work every day. They work a full 40-hour week. They may work overtime, but they're working at a place that does not have health benefits or does not pay a wage high enough that they can afford insurance. And that's part of what the exchange is intended to correct, is to give some sort of stipend or subsidy to the insurance company to reduce the rates so that people who might want to be able to buy insurance can do that. The problem is going to be that still rent, groceries, car payments, there are other things that are going to come first. And it is really probably impractical to say that those people who are working hard and don't have coverage and in low-dollar jobs are going to have enough money even with the exchange to get picked up. So you're right, they're still going to be in the emergency room, and with the money now not coming to the hospitals to help cover that, it's going to fall back on the taxpayers, because many of these hospitals are owned by the counties in which they're situated.
Some people have theorized that the hospitals will go back to those that are carrying insurance and that rates will go up because they got to recover the money they're losing. Have you heard any testimony like that, Senator Martin?
There was some on the testimony in our subcommittee on that. The other thing that we heard was from, I believe, the Greenville Hospital System, that they tracked like 80-something patients in their hospital that were chronic users of the emergency room, and they've been trying to focus on getting them handled, because at one point I believe they said it was $900,000, and as they monitored that group, they had gotten the cost down to like $400,000 a quarter. So it's a small population that's going and abusing the emergency rooms, and that's one thing Director Kechter talked about, was trying to get a handle on those people who consistently use the emergency room as their primary care.
But isn't the disproportionate share millions of dollars?
Oh, absolutely.
Isn't it millions?
$400 and something million
from the feds
that have been going to the hospitals, that under the act are not going to go to the hospitals, because when the whole bill passed, it was assumed that all parts would go into effect. When the court ruled that the mandate didn't go into effect, they didn't go back and readjust the disproportionate share money.
I see. All right, well, so let me ask the two of you. The House of Representatives, I'm looking at my notes here, they didn't take the Medicaid expansion. And instead, they, first of all, appropriated $35 million to hospitals to steer away from the emergency rooms to free clinics, patients. Now, do y'all think that I'm asking, is that something you would support? And do you think it will handle the question of keeping the hospitals from having a deficit because of uninsured? What's y'all's take on that? Y'all have any feelings on that?
Senator, I'm going to be honest with you, I haven't reviewed what the House passed.
Well, I'll say this. We're going to have to help the hospitals with state money to make this work, because they're not going to receive the federal money. So I don't know whether 35 billion is the right number, 35 million is the right number or not. But my point would be, why would we want to appropriate them 35 million when all we'd have to do is accept the expansion, and we could draw down 20 times, 30 times that much money at no cost to the state, and we'd have this everybody covered at that point. The hospital, let me say this, if this goes through what the House done, it is a small Band-Aid on a large wound. It might sustain the hospitals for a little bit of time. It will not sustain them over time. Ask any hospital board member, administrator, people that work in the hospital now, and they'll tell you that what's needed is Medicaid expansion. We've got to move these folks into being insured, so they're not coming into the hospital and using that as their primary health delivery system.
I'm proud to say that my local hospital in Spartanburg is not advocating for Medicaid expansion. They just feel like it's a temporary solution that's going to hurt them more long term. They're looking more for solutions like we've been talking about in our committee. And I think that's one thing the Senators from Orangeburg and I do agree on, is that slope has gotten too high. And we're going to work on solutions to bring that slope down. Now, that is separate from the Medicaid expansion issue we're talking about today.
Well, the House also put $10 million to go to the state's 20 federally funded health clinics. So that's another 10, so up to $45 million. And they also then took $20 million to pay 100% reimbursement on uninsured, but only to rural hospitals. Orangeburg is not a rural hospital. Spartanburg is not a rural hospital. So we're talking here that 55, 65 million right there. Y'all have any thoughts on that? I'm hitting you. It just passed the House, so I don't know
the money part, but I do know that Director Keck did testify of some of the hot spots around the state, and that must be what they're trying to target.
So if you took $65 million this year and you did it again next year and the next year and the next year and you did it for 10 years, you'd have $650 million, which is exactly what it would cost us for our share of the match when the time comes. So this idea that when 90% is only being paid by the feds and we've got to come up with the other 10, I hear them saying, well, we won't be able to afford it at that point in time. We're affording it now. We're paying that now, $65 million. And you span that out over 10 years, you're going to have the $600 million that you need to match what we're going to have to match at that time.
I was pretty sure it was $600 million a year was his low estimate.
Well, I know, but so that's $65 million we're putting in this year. You know what will happen. We'll put that in, and it won't be enough. So next year we'll have to put in 65 plus 65 more. BEA always comes up with how much money we've got, and what you're wanting to say is you don't want the new money to go into health care because we're already spending too much of our budget in health care. What I'm telling you is this $65 million is not going to work, and next year it's going to cost more because it usually does, and the year after that it's going to cost more. We'll have the money. We'll be spending it anyway. We just won't be using it to draw down the 90% of the money that goes with that. It'll be out in Nebraska somewhere, California. And that's what people ought to know. If we don't accept this money, your hard-earned tax dollars that are in Washington are going to California.
Well, let me ask the two of you, because the Medicaid program, in my opinion, is currently constructed, is unsustainable. That's different from the issue of the expansion. Isn't part of the problem somehow we need to get a voice to Washington that we need flexibility with Medicaid dollars? And because, like in the seniors issues, they're plugged in to nursing beds, but not everybody needs to be in a skilled nursing bed. They could be in something of lesser amount. And if we had some flexibility with those dollars, wouldn't they be more manageable? Have y'all heard any testimony on that?
I think we probably both agree on that.
Yeah, I think we do. I think if you look at our schools, they've asked for flexibility year after year, and we've given them about the maximum flexibility they can with the dollars, and I think that's working. So I believe that we do agree on that.
The 50 states around the country are not the same, and it doesn't make sense that we all have to spend our Medicaid dollars under the same set of rules. We've got different types of populations, different health needs in different areas. You know, we're part of an area where stroke and diabetes and some things are more prevalent here. And there are other states that have different health problems. So I do think that flexibility would be a good thing, and I think eventually we'll get some sort of flexibility from the federal government. It'd be nice to know that the governor's out there advocating that she would take the money if she could get flexibility. I think they're doing that in Arkansas and some other places. They're saying, look, we want the expansion, maybe not exactly like you wanted it, but because we think we could spend the money better. The money's going to go away. If we don't take it this year, we're not going to get it. They're not going to give us twice as much next year. We haven't even asked the government if you would give us flexibility, will we take the money? We're just saying, no, we're not going to take the money.
Well, let me ask you one other thing. In the testimony y'all have had, and to our viewers, has anybody explored, and let's assume that we don't take it, and let's assume that the population out there of uninsured is there. They go to the hospitals. The hospitals start taking it from those private payers. Was there any testimony as to whether or not the folks who have private insurance will get the full tax now for the uninsured rather than the federal money paying for it? It's the federal's law. It's not the state's law. Was any testimony, discussion on that as to whether or not there was going to be a pass back to the people that are carrying insurance, and will that make this state less competitive in economic development up the road?
Well, you're right about that, because the big companies, that the Boeings and the BMWs, and I use those as examples because we're so proud of them, they have health benefits for their employees. What they're paying for their employee health benefits is going to have to go up if the medical system is going to take in the same amount of money, and we're not taking the money that's being offered to us. It's got to come from somewhere. It's either got to come from people who already have insurance paying higher rates or from taxpayers, one or the other. Or either hospitals are going to close, and we cannot have that. So this just seems like such an easy decision to make. Let's take the money. If it doesn't work at the end of 3 years, let's stop. But I submit to you the reason that we won't stop at the end of 3 years is because it will work. It's worked in other places. It will work here.
Senator, I give you an opportunity. If y'all have any testimony on that, and the other thing, let's flip the question back over. We take it. Where we will get the $600 million from?
Well,
anybody looked at that? Where's that coming from?
This is what I think, and I don't remember any direct testimony on your exact question, but I think when you've got education, that's K through 12 is about 48, and the total education with higher ed is about 54% of the budget. I think when you start looking for money and you've got something like that, that 54% of the budget, that's where money's going to end up getting. That's where the cuts are going to be. They'd be in education.
Well, I don't think we're going to cut the education.
I would hope not.
Well, I don't think we're going to cut the education.
I'm just saying if you cut into a budget and something, if you've got a household budget and something's 54% of that budget and you have to make budget cuts in your own house, there's some portion of that 54% that's going to get touched.
But you wouldn't have to cut any if you took the money.
That's what scares me. Well, but even with the money, even with taking the money, you've still got to find at least $600 million. I think the big question on Medicaid expansion is we don't know that $600 million to $1.9 billion. That's the range, and I think.
But that's 10 years from now. That is 10 years from now. I submit to you, if we get 44,000 new jobs in this state, pumping $3 billion into the economy, we will have enough money coming in to be able to afford that 10 years from now. We don't have to afford it next year. Next year is free. The year after that, it's free. Then it starts a sliding scale. In the end, it may cost $600 million. By then, we'll have all the new doctors and nurses and healthcare providers trained and here and working with new jobs, paying taxes, putting money in the economy.
We've got less than a minute. That's the one thing we don't have is enough time. So I would ask each of you to make you, very quickly, make your best pitch as to why we should or shouldn't take it.
Well, I feel that we should not take it because nothing from Washington is free. Washington is $16 trillion in debt. I think any promises they make to us are just their promises made on borrowed money.
Senator?
I submit to you that if we take the money will be here. It will come and we will use it wisely. We will use it to cover people that do not have insurance. Everybody in our society who is sick deserves quality treatment. If we're not going to treat them under the plan that the federal government has passed, we're going to end up paying for it ourselves. That doesn't make any sense.
And I hope you, the viewer, now see why this issue is going to be debated here. Two sides to the question, two different views. The challenge ahead. What's the best for South Carolina in the years ahead as we deal with a law that nobody is absolutely certain as to what the consequences are going to be? And I hope this program today gave you the opportunity to see that. With that, we're out of time. Thank both of you. We'll be back again with different issues here at the State House.
Broadcast of this program is made possible in part by the South Carolina Farm Bureau, online at scfb.org, and by the Columbia Metropolitan Airport, online at columbiaairport.com, and by Time Warner Cable, online at timewarnercable.com.